The president's set to hold that rally, by the way, momentarily in Nashville to promote the health care legislation, the ACHA bill, or Ryan Care, as it's been called by so many. Joining me now to discuss the prospects of Ryan Care is Congressman Michael Burgess. He's the chairman of the subcommittee on health and helped craft the bill in its current form. And he is the longest-serving doctor in Congress, so he knows everything about ACHA, the Obamacare, and health care, most importantly of all. Doctor, great to have you with us, and it's
Thank
good
you,
to
Lou.
see you.
You're very kind. Thank you for having me on.
Okay, well, that may expire here any second when we talk about Obamacare and Ryan Care, but I know that you feel strongly about the Ryan Care legislation. As you know, the conservatives in your caucus are deeply disappointed in what has been produced.
Wait just a minute, because this is only one step of a multi-step process, and as I look back at the landscape, we are right on the cusp of the 7-year anniversary of the passage of the Affordable Care Act, and I have waited for this day for 7 long years. Sure, I want to get rid of the individual mandate. I want to get rid of the employer mandate, and we're on the verge of doing that. Is the bill, as it was reported out of my committee last week, is it perfect? No, in many ways it's not, but it is a positive first step, and credit to all the people that have worked so hard on this and put so much heart and soul into trying to get to this day. The Vice President has been with 3 groups that I've monitored today, and with every group, whether it be moderates or conservatives or just the conference in general, he's thanked us for having the steadfast courage to be against this thing right from the get-go.
He is without question gracious, and he is also a man of immense patience, I think, and is also trying to put together a deal. To his credit, he's trying to put together a deal which, frankly, your leadership has made it more difficult than it need have been. 7 long years, as you put it. We know some of the issues. We know about chronic care and the immense burden that places on all health care dollars in this society. That bill does not address it.
Wait, I actually disagree.
Let me finish, if I may, Doctor. We know also that premiums should go down because the President of the United States said that in his campaign for the office.
Correct.
And the premiums go higher, according to the Congressional Budget Office, in the first 2 years before going into decline, not necessarily at either the rate or the depth that we would like them to. And it does not expand health care itself. Indeed, whether you look at the Medicaid expansion, or whether you look at the actual coverage and the choices made, not on the part of younger people primarily, to take the coverage, we're talking about somewhere between 7, 14, and 24 million people who will be without coverage. Is that a fair statement?
Well, you're, of course, quoting,
I don't know whether you like it, but
extensively from the Congressional Budget Office report.
Silly me. You're the guys are the ones, who sent the legislation over there.
I will say this about the Congressional Budget Office. I am less impressed about their ability to predict human behavior. You know, they were wrong on the number of sign-ups for the Affordable Care Act. They were wrong about Part D on Medicare. I'm not sure if they are wrong on this projection or not. I guess we will find out. As far as the delay in the reduction of the premiums, I mean, it does take time because of the way the actuarial content of insurance policies is put together. Impossible to affect anything right now for this year because the contracts are already out. It's very difficult to affect anything for next year because that data has in fact already been collected.
I commiserate, Doctor, I really do. Except for the fact that in that 7 long years we have had sufficient advance notice of what we would have to contend with and to come up with, to conjure plausible, effective, and pragmatic solutions to each one of those elements that are disappointing and frustrating to us all. What now is the matter with the process is the refusal to accept amendments within the House. Both your committee, Ways and Means, Energy and Commerce, both did not accept amendments. Now the legislation, we have to take it on faith that it would be moved to the Senate for a vote there, where what happens? We don't know, because there's no public hearing and there's no public discussion. And this is and we have a speaker, your speaker, telling us it's a binary choice, like we are third-rate, tag-alongs on citizenship in this country.
We had a 27-hour markup in our humble little committee last week.
No, I understand.
And
you set a record. But you know what? You didn't amend a doggone thing.
Well, the amendments that were offered were principally offered by the Democrats, and they were amendments that would have violated the rules of the Senate and ended the privilege to have this heard with a 51-vote majority over in the Senate. So they were, in effect, poison pill amendments. And yes, we did defeat all of the Democratic amendments. And I was actually proud of the men and women on the Energy and Commerce Committee for standing strong in that. Look, the President and the Vice President have both said, if you've got ideas, we want to hear them. I think they have been open in that process, and we'll see what develops over the next week's time. Lucky me, I get to do it all again in the Rules Committee next week.
Congressman, we got to jump. Congressman Burgess, thanks.